Hi, my name is Dr. Patel here at the Tooth Experience in Edmond, Oklahoma, and we're going to talk about teeth extractions. When is it needed? That's the biggest question I get. Teeth extractions can be recommended for multiple different reasons, whether we have fractured the tooth, whether we have a big cavity, whether there's infection in the bone surrounding that tooth. These are all good causes to have the tooth extracted if we can't find a different solution. I always recommend that we try to save as many teeth as possible, but there are some cases where the teeth just can't be saved, and that could be that it has fractured to a point where it's just not salvageable. It has infection that is outweighing the pros and cons of keeping it versus just taking it out. Teeth extractions really aren't the end of the world either. Nowadays we do have ways of replacing that tooth and things like that. We did talk about ways to kind of replace teeth in a previous videos, and I want you to kind of hit the link above to kind of see that video and follow up. Teeth extractions aren't always painful. That is quite a misconception. We try to make the area numb as much as possible. That way the patient doesn't feel it. Yes, you will still feel pushing and things like that. Those are things that come along with the extraction, but in most cases patients aren't feeling a whole lot and walk away with possibly just some soreness. So you want to keep in mind anytime we're doing a tooth extraction, it is invasive. It is a type of surgery per se. When we go to a doctor and we are talking about taking possibly a kidney out, it is just as important when we're taking teeth out, and so I don't want you to get the perception that taking teeth out are no big deal. It is an invasive procedure and it is a surgery. However, we do have a lot more teeth, and it is a lot easier to take out a tooth than take out another part of our body, and so sometimes can be thought of as a less invasive procedure. It does have some recovery time and you might be sore after, and so that is all things you want to keep in mind. With extractions, I want you to know that there is a sort of recovery time and each patient is a little bit different. However, I normally see patients back to normal in about 2 weeks. Recovery usually just means a little bit of soreness. Doctors usually recommend some pain medication or have a pain protocol, and I want you to make sure you know that you need to follow that to the T to have the best results possible. One of the tips I do have is saltwater rinses goes a long way. So just after an extraction, kind of putting some salt water in, swishing that around, going side to side with it, and just keeping the area clean will help make that recovery time be as less as possible and make sure we heal very well. The average cost of an extraction can range anywhere from $100 to $300, and so it sometimes seems as the easier option. One of the things with extractions is it is a little bit financially easier and less of a burden, but I do want you to keep in mind that it is part of you that you're taking out. Once we take out a tooth, we can't just put that tooth back, and it does come with a lot more dental procedures to kind of replace that tooth. And so yes, it is cheaper and easier sometimes to have a tooth extracted, but you really need to focus in on, if we can save it, trying to save it. And again, when we talk about extracting teeth and it's $100 to $300, however, you want to keep in mind replacing that tooth costs a lot more, and so I want you to go follow the link above and make sure you check out the video on implants and see how more expensive it is to replace that tooth with an implant in the future. And so sometimes it might not be the best case to just have the tooth extracted. With extractions, recovery time can be about 2 weeks, but it does depend patient to patient. One of the main things that I want you to focus on after an extraction is making sure we're keeping the area clean and really using things like salt water and things like that to keep the area nice and clean, making sure we're not leaving any food or debris in that area. You can start brushing it 3 to 4 days after to kind of help that area heal well. Hey guys, I just want to recap about extractions and everything we talked about, but first I want you to like, subscribe, and hit the notification bar. Extractions can be difficult to talk about because one of the main things that people associate that with is pain. That doesn't have to always be the case. Nowadays we're making sure patients are nice and numb and feel as least amount of pain as possible. Yes, you do feel some pushing, but other than that, you shouldn't feel anything else. We talked about how an extraction can just be a couple $100, but I want you to keep in mind that replacing that tooth costs a lot more, and so trying to save teeth as many as possible would be our best bet for the long run. Thank you guys, and we'll see you on the next one.